We are live. It's Dr. J in the house with Rob Edwards from Heritage Health Life. We're excited to chat on today's podcast. We're going to be talking about when good bacteria goes bad, while you may be having probiotic intolerance or probiotic side effects. We're going to dive into this topic. Having worked with patients, 5,000 plus patients over the last 15 years, every now and then you see this, and it's a real thing. And so we're going to dive into what's happening under the hood physiologically and biochemically that's driving this and what you can do about it. And what does it mean? What is it telling you? Rob, welcome to the podcast, man. How you doing?
Yeah, good. Thanks for having me again. It's been a while. It's been like about a month and a half, 2 months, something like that.
Yeah.
Been working the fields of helping out people getting healthy, and so I'm excited to dive into this, talk about some of the common things that go on with that, and I think one of the things to notice is that it's always about balance inside of the body, and so let's hop into this conversation. I'll let you lead the way, man.
Absolutely. So out of the gate, we have beneficial bacteria. These are probiotics, right? These are going to be your bifidobacter, your lactobacillus, your different subspecies, lactobacillus acidophilus, lactobacillus casei, plantarum, bifidobacter longus, etc., brevis, right? Lactis, infantis. So you get your different probiotic species, your bifido, your lacto, and then you'll have some of even your spore-based strains like your Bacillus clausii, subtilis, coagulans like Informis. And then you'll even have like your kind of beneficial yeast that kind of get lumped in like a Saccharomyces boulardii. These are your big kind of three beneficial bacteria. Probiotic bifido, spore base, right? Your Bacillus, and then your Saccharomyces. Those what we call it the big three probiotics. And when we deal with any type of gut issue, most people due to excess antibiotics exposure in the past when you were younger, or just having, common cold issues. With most cold issues are viral, and you're given antibiotics doesn't really help, right? You can go wrap your head around that one. Also, we have exposure to conventional food like Roundup, glyphosate. That's originally patented as an antibiotic patent. And so if you're getting exposure to lots of glyphosate in conventional food, that can definitely negatively impact the gut bacteria balance. And then obviously lots of acellular processed grains, processed flour, processed high fructose corn syrup is going to feed and tend to cause a lot of the dysbiotic bad bacteria to flourish. The bad bacteria may be in the camps of like Proteus and Morganella, Pseudomonas, Citrobacter, Klebsiella. These are all dysbiotic bacteria. We all have them, but it's really when those levels get overgrown, that's where they become problematic. And these bacteria can produce things like histamine. They can produce lipopolysaccharides or endotoxins. They can actually be stressful on the body. And a lot of times when people have issues with beneficial bacteria, it's because the histamine bucket in that patient is already very high because bad bacteria really increase that histamine. And then if you add in a beneficial probiotic or like a fermented food, that's going to be adding more to that histamine bucket. So it's not the fact that the probiotic's the issue, it's that your histamine bucket a lot of times can be already full.
Yeah, and histamine is like a big deal. Other sort of like probiotic foods, right? So like the sauerkraut or the kimchi, kombuchas, kefirs, those are also can cause some issues with that as well. But yeah, it's the gut is oftentimes a tricky subject for a lot of people as we kind of try to help those things out. And prevalently, people think I just take a probiotic and I'm going to be good to go.
Yeah,
but you follow down the pathway of the gut. Like, what do we look at first, second, third, fourth? Depending on what's going on. And sometimes people can miss things with gut health. And so that's another big piece of it. Like, for example, if you got indigestion consistently, right? Maybe it's tearing up your pipe ways. And if we have that inflammation there, we need to take care of that first and foremost before we start looking down further into the gut.
Now, here's the deal. Most people can benefit. Like, let's say you have a little bit of like tummy upset or your gut feels a little bit inflamed. Probiotics can be very naturally anti-inflammatory. I'd much rather have someone like from like an acute palliative perspective, using probiotics to kind of help with inflammation than taking NSAIDs or taking acid blockers, because those medications are actually going to impact gut lining, liver health, and acid blockers are going to impact digestion and absorption. So if we're doing things acutely, I much rather have people use probiotics because they can help with inflammation. But if you're having side effects, what does that mean? I want people to think like one step ahead of what that actually means. And then what can you do about it? Once you understand the physiology and the biochemistry, symptoms go downstream from physiology and biochemistry. When things aren't functioning optimally with the biochem and the physiology, then we have side effects with bloating, acid reflux, constipation, motility, soft stools, malabsorption. All those things spiral from that.
Yeah, and even like the DAO, like in the Krebs cycle. So if you have a breakdown in the gut lining, you're not producing enough DAO, for example. That's what sort of digest, let's say, histamines, right? That could be another issue to potentially look into in terms of the gut and its function, its ability to break down histamines properly. And so the fermented foods is going to be a piece there. I think avocados, just a list of obviously the fermented foods that some people have a difficult time with, but yeah, that's another big piece here, is to look at the gut health, the lining, what kind of damage has been done to the gut. Can the gut still produce DAO? Can it still produce all of the things that it needs to produce to break down histamines in the first place? And, or is it being sort of overstressed? And if you have overstressed gut, then we're going to start to have those histamine responses, reactions. Eventually, those things get into the bloodstream, and you can have brain fog and skin issues, and all these other things kind of present themselves as well.
Yeah, 100%. Now, when we have histamine, so histamine is a valid reason why you may have probiotic intolerance. So how do we know? You have some fermented, some kimchi, some sauerkraut. Maybe you have some kombucha. Maybe you have some fermented pickles. You start to get brain foggy. You start to get itchy, hives. You start to get maybe headaches. These all can be very, common, let's just say, high histamine symptoms. And so maybe you start to notice it also with bacon. Maybe you notice it with more citrus-based foods. So I always say, look at your high histamine foods, challenge it. How do you feel? If you notice those issues, you probably could be a probiotic intolerant, probiotic side effect person. If we add in a good probiotic, that could potentially be a problem. Now, in my line, we have the ProBioFlora, which is kind of the Bifidobacter and Lactobacillus. And then we have the Sacroflora, which is going to be the Saccharomyces. These are our big two. And then we'll add in the Bacillus as needed as well. Now, when we have a lot of dysbiotic bacteria, that histamine bucket is full. So any beneficial bacteria could put us over the top. Fermented food could have put us over the top. Maybe we have dysbiotic bacteria like Pseudomonas, Klebsiella, Citrobacter. Those could be producing histamine inside of our gut. So we're like a histamine producing machine. And now we have histamine stimulation from allergens out in nature, different danders and pollens and grasses and such. But now maybe let's say we have some mold issues in the house or mold issues outside from just, nature naturally decaying, right? Plants and things and leaves decaying. But let's say we have maybe some mold damage from a leak. Now those things put our histamine bucket super high. Like you could just have a mold issue. You're living in a moldy house or apartment. That could be enough to fill your histamine bucket. And now you're having headaches, brain fog, fatigue, skin issues. And then now you're super sensitive with the food, right? And so it can come in many shapes and sizes. When that probiotic intolerance happens, I want people to think deeper. What are the underlying causes why it could be? Now, we could definitely throw in some DAO, and we could talk about, natural things that we can do to kind of degranulate histamine, but I'll let you kind of comment first.
Yeah, no, I think that's absolutely true. And that's more like the palliative, right? Like it's not going to solve the problem, but it at least gives some relief in terms of that. But yeah, I think, when we talk about the gut, sometimes it's complex with regards to that. And what Justin is talking about is this histamine bucket.